Again, warm welcome to you as well. So we want to go ahead and share, from your experience so that other patients can ask you questions. Now, if you
Yeah,
could please tell us, how old are you and where are you from?
I am 45 and I'm in England in the UK.
Okay, we just did a Facebook Live 10 days ago from a nice lady from Scotland.
Yep, we've
Yes,
been chatting behind the
so
scenes.
yes. I will tell you, I have a lot of patients from Europe, from Switzerland, from Italy, Germany. And, if there is ever anyone who wants to do like a Facebook Live or a Facebook group member or who manages, feel free to reach out because we want to learn from your experience, from my experience, how I do it. The explant surgery is very unique and it's very
Yeah,
surgeon specific. Now,
yeah.
so you're from there. Now, let me ask you this. When did you get your implants?
It would have been about 2006, 2007.
Okay. Now, you got saline implants or silicone implants?
Silicone.
Silicone. Okay. And you had
Yeah.
these done where?
South Africa.
South Africa, right?
But,
And so
but
you
one was
got,
in the UK, just to make that a little bit weird.
oh, what is that again, please?
One of them was done in the UK, so my original surgery was in South Africa,
Correct,
and then
as
I
I
needed,
understood it. Yeah, the very
yeah,
first one in 2007, the
yeah,
original first one was done in South Africa. And
yeah.
then these were the first set were silicone or saline?
The first step was silicone.
Silicone under the muscle.
Yes.
Okay, and where was the incision that was made in order to put them in?
Quite low down underneath the
Got it.
sort of
And
breast
under the
line.
crease. Now, I know
Yeah,
all of this, but we want to hear from you. This is how I conduct my phone consults as well, because I
sure.
want to learn what was the access point. Is it through the nipple areola, through the armpit?
Yeah.
Sometimes some patients have had their surgery done through the belly button, which is a big no-no. Now,
Wow.
yeah, so I learn a lot about the surgeon too, because anyone who goes through the belly button, I know this was not a board certified plastic surgeon. Now,
Yeah.
next question for you is, what led you to get the second surgery?
The second surgery was a revision on the left side. I'd had a pretty bad horse riding accident that had led to the left one sort of migrating, and it was giving me problems. So I had that revised in the UK, but he would only do the left side.
Got it. Okay. So you got the left side done. And what year again was this?
That one was in 2015.
2015. And again, silicone implant or saline implant?
It was silicone, but this time he put in textured. So my first set was smooth, and it's quite hard to find someone to do smooth in the UK, so we put in textured. So I had one smooth, one textured.
Right. Now it is important. All these details, smooth or saline or textured, very important because remember the textured implants clearly are notorious for their association with BIALCL, but
Yeah.
guess what? The smooth as well, but to a lesser extent. And
Okay.
saline implants as well have been, but to a lesser extent. And we do not know the exact numbers because it is underreported. Now, so you had your surgery done for symmetry because of your car accident. Now, let me ask you this next question. At what time did you decide that you were going to explant?
I'd wanted to do it from about 2020. At the time, I was getting unexplained pain in one of my sides, and I didn't know about breast implant illness at the time. I didn't know explant was an option. So, but my journey started in about 2020 because I just started getting pain in the left side. It was unexplained pain that got worse, and that sort of led me on the journey to find you.
Got it. Okay. So you wanted them removed. Now, at majority of the ladies, the patients, they think about replacement. Were you thinking about replacement?
Yeah, at the time, I just thought I could have them replaced. That I just thought that would be fine. And when I was doing it just for the pain, hopefully to rid the pain, no one could guarantee the pain. So they
Mm,
didn't, because they didn't know what was causing it. If they were to replace it, they couldn't guarantee the pain would disappear. But it was through doing all that that then other things started happening that led me on the BII path.
Got it.
that then I wanted them out. But to begin with, no, I was going to be happy with the replacement, and I'm really glad that didn't happen.
Right, right. Now, this is very important. Now, what happens is one patients can get a capsular contracture. Initially the implants may sit further up. Over time, they only move down. And
Right.
sometimes they may then be impinging upon a nerve, and then you can
Yeah.
get referred pain. And I have removed neuromas, which is basically uh, very sensitive nerve endings that occur as a result of scar tissue of the nerve, that when you touch, you just jump up. And this is in the proximity of the implant, especially a textured implant or be a smooth
Yeah.
implant. And you could certainly be getting referred pain as a result of that quote malposition or the inflammation. Many patients, if you will, and don't listen to my words, listen to the words, the complaints of the patients. They will mention that they have tingling numbness in the arms and legs.
Yeah.
They go to their neurologist, they do an EMG, and they say, you don't have carpal tunnel, you don't have sciatica, but whatever it is, and it is the inflammation around the nerve that causes this pins and needle type of sensation, tingling sensation. And it is very real. Not everyone, but a small subset of
Yeah.
patients complain of that. So you can have pain, neuroma pain, direct pressure on the nerve pain, or tingling sensation on the arms and legs, maybe just on the arms or maybe just on the legs. Now, so you're doing your research,
Yeah.
and so you're actively basically involved. And what type of research did you do?
It started so after the pain, I actually started getting heart palpitations, and that's what led me onto the path of doing the research to discover the BII side of things. And to be fair, it was actually my cardiologist who said, I'm seeing this a lot in women with implants, and you should maybe look at having your implants removed. To which my breast surgeon at the same hospital said, I wish you would stop saying that. That's not true at all. This is lies. I don't know where they're getting this from. So that's when I got put on the path. It was actually because of my cardiologist. So it was pretty much that same year I started looking around and speaking to different sort of surgeons in the UK. Didn't get very far because no one wanted to take. Everyone said I should have kept them in. I didn't see one surgeon in the UK that would just take them out
How many
and
surgeons did you
explant
talk to?
for.
Well, four plastic surgeons.
Yep.
Now, I'm going to
And
say this to
yeah.
everyone who's listening, including your plastic surgeon, with all due respect to him or her. I have you who's complaining of the irregular heartbeats, the
Yeah.
palpitations of the heart, and someone relatively young with no blood pressure, no heart issues.
No.
I have the plastic surgeon who's saying it cannot be the heart. Now, I will tell you, if I am non-biased and if I take 10 steps back and I look at the many patients who
Yeah.
have had an explant, and you see them afterwards saying, my palpitations are gone, my
Yeah.
blood pressure has improved, and the if you look at the hard facts alone, have you had any palpitations since you explant? No.
Nope.
Yeah.
None.
Now I will say this to you. I will never trust the plastic surgeon who has an incentive. I will trust you.
Agreed.
And this is the number one problem reason why this is happening. Breast implant illness or these complaints totally disregarded because no one wants to listen to the patients.
Yeah.
As simple as that.
I agree.
Everyone has their, oh, we're going to get you dismissed. You probably, and believe it or not, I myself, as a physician, as an MD, I have heard this. You're probably
Yeah.
doing drugs. You're probably stressed out. No, I've seen my patients are
Yeah.
telling me this, right? Because anytime a young patient walks into the emergency room, they are thinking cocaine overdose. Believe it or not, this is the
Wow.
reality of an emergency room doc here in the US, at least. Number
Stress
two,
was a
you've
common
got
one that I
anxiety.
got.
You have anxiety, you have panic attacks. Number three, you're stressed out. Number four, are you taking the 5 hour energy or the monster drink that sometimes can cause these arrhythmias, right?
Yeah.
Now, I will tell you, one of my patients that came to me a few years ago, this is around the time of COVID, the cardiologist called me up through a mutual friend and said, can you remove her implants because her implants are getting trouble to my patient? And she had
Wow.
significant pulmonary hypertension, and he said it is the implants. And I said, you're a
Amazing.
genius, and I'm going to put you on Facebook Live because I agree with what you're saying, because
Yeah.
this is the, and I want to put your cardiologist on as well and explain, because this was a report on Medscape, and we put this up on this publication up on our Facebook page about the harmful effects of the implants and the patient's hearts, right? So we
Yeah.
had patients that had been on 5 blood pressure medications, and they came off
Wow.
once the
I can
implants were
believe
removed.
it.
And it's a direct, I use the word because this is the inflammation and the proximity. The cardiologist explained it: the vasculitis, the inflammation of the blood vessels, and the inflammation of the area in and around that causes the irregular heartbeats. Clear association. And myself,
Yeah.
I have heard this so many times, where the patients have palpitations after palpitation, to the point where they're put on
Yeah.
beta blockers or basically anti-anxiety meds to suppress as needed, for
Yeah.
propranolol, for example. And then once the explant, all of a sudden overnight the symptoms disappear. So you've not had your irregular heartbeats.
Not one. And the night palpitations were horrendous. Like you didn't know if you were dying. Was as many women who watch will experience, you just don't know what's going on. You feel like you're making it up because no tests are showing anything. Doctors aren't believing you. But then genuinely, since the day they came out, I've not had any.
Right. And your surgery was not yesterday. Your surgery was 9/6/2023.
It was almost 2 years ago.
Yeah, yeah, 2 years ago. And I will tell you, I still remember you vividly. I remember your accent. And, this is 2 years of evidence. Now, I will tell you, and with all due respect, I want the plastic surgeon who denies the palpitations not only to listen to you, but the many other patients, not only
Yeah.
on my Facebook page, but all around. And you will see the complaints are very real. And you
Yeah.
will see the same trend: palpitations, explant done right, and now resolution of symptoms. Now,
Yeah.
what were the symptoms that you were going through in order to basically convince yourself that you needed to do this and not get a replacement?
Pain was the biggest thing because I wasn't sleeping at night. I was at the point where I was taking a shower in my sports bra because the left breast hurt so much. So for me, it was I couldn't risk putting them back in. And then when I saw sort of my first ever breast implant illness list, I ticked so many boxes that had just been palmed off as, oh, you're perimenopausal, you're getting older, it's stress, it's anxiety. So like I had all over body itching that would just come and go with no pattern. It was like those mites in my skin. I had thinning hair, like I was starting to lose my hair more and it wasn't growing back. So the palpitations were a big thing. The most craziest night sweats where I would wake up and the sheets were wet, pajamas were wet, like it, and so the doctor's like, oh, you're menopausal, perimenopausal. There were so many things. And oh, dry eyes, that was the other, like I constantly felt like I had sand in my eyes. And that the sand in my eyes went the day I woke up as well. That was crazy.
Yeah, now I will tell you, you're very young.
Yeah,
You're like, you're just,
thanks.
and for you to go through this now, I will tell you, this is the Sjogren's syndrome, which is the dryness of the eyes, very common in patients. So the MD Anderson study, where they looked at 100,000 patients, it's a study of studies, and they said that the patients who have implants, they have a significant higher chance, 8 times higher, of getting dryness of the eyes than the
Oh, well, of
patients who did not. Now, remember, this study has its limitations, but they studied
course.
80,000 patients with silicone implants, 20,000 with saline, and it was a study of studies. And they basically said that the dryness of the eyes relatively very common in patients. So this was a significant finding.
Yeah,
And if you put the two and two together, for someone young and overall healthy like you got the pain, you have the dryness of the eyes, you have what you mentioned, this many other symptoms. If you put
yeah,
two and two together and all your lab tests are negative,
yeah.
and you basically your doctor says you're in excellent shape and health, and you're like, I'm losing my mind but I'm not healthy. This is where I say, feeling sick, no answers. Everyone says it's in your head. It's BII till proven otherwise, because it's a
Yeah.
diagnosis of exclusion. and I held the questionnaire right here where all the symptoms from brain fog, very common, fatigue, the most common symptom of what is breast implant illness,
Yeah.
dryness of the eyes, GI disturbances, irritable bowel, ringing in the ears, arrhythmias, rashes, all of this comes in, and believe it or not, you have what is every finger is now more and more pointing towards what is breast implant illness. Now there is no
Yeah.
test, no imaging test, no lab test. The ultimate test is when the surgery is done right and you look back and say, you know what, this is the before and after, and
Yeah.
you will see very dramatic improvements because your body is not lying to you. Your dryness of the eyes is not lying. Your arrhythmias
Yeah.
are not lying. Why would you, a young lady in the middle of her life, come up with all these excuses? Is it the stress?
Exactly.
No, it is not. And this is the same recurrent theme. If only the doctors listen to the patient and you see this pattern recognition of problems. This
Yeah.
is where I talk to patients and I ask them in my phone consults, what percent chance do you think you have breast implant illness? And they say 100%. And look,
Yeah.
here you have surgeons saying 0%, and here's the patient saying 100%, and now you're overriding the plastic surgeons. This is where the strong ladies, the ladies who have done their homework, strong in a sense that because I will tell you, if I go to a doc and the doctor tells me this is the problem, I'm going to believe in him or her wholeheartedly, religiously, blindly, because the doctor is telling me he's the
Yeah.
higher authority, right?
Yeah.
Now, the bottom line here is this higher authority is failing me, and this is
Yeah.
unfortunately the reality of the problem.
Yeah.
The symptoms are being dismissed, and this is where. Now, let me ask you this. So, you went to four surgeons, and
Yeah.
you've done your homework. Now, what type of homework did you do? Like, what research did you do? Because it takes a lot of effort to cross the Atlantic to come to me or not go to Europe, France, Switzerland. You have phenomenal doctors in Germany as well. Like, what was going through your mind as you chose to come here?
The biggest thing, but the thing that, I mean, I saw someone else's live the other day and I totally resonated with it. It's going to be very cheesy when I say this first bit, but when I first found yourself on Instagram, I instantly knew you were my surgeon. I don't even think he'd said one line. And I was like, that's my guy.
Mm.
But I'd done research into, luckily there's the communities that are online for BII are close and everyone wants to share. So that's how I discovered you need to have an end block. Like everything needs to come out. You can't be leaving a little bit of the capsule in. So, like I said, unfortunately, when I got speaking to the people I spoke to in the UK, they were quite dismissive on explant. They wouldn't guarantee an end block. I was even told that a lady of my build and stature looks better with implants, so I should keep them. I just didn't meet anyone that understood or accepted BII. And that's when I went overseas. And to be honest, there was a few guys in the States. You came up, but your community is fantastic. Everyone shares everyone's story. Everyone seems to it was just obvious that you're the guy that should come to. You don't put in implants, you prove. I mean, I got all the pictures at the end and a video of you, so I got to see everything that you'd taken.
So very
And
important. So yeah, if I may
so
jump in,
disgusting.
yeah, I will say this to you. If you go Google in Chicago, Los Angeles, Miami, breast implant removal, you will be shocked to see that every single surgeon is now doing it. They're
Wow.
still augmenting, and you will see, and they're writing down, and again, this is objective evidence, right? And you will see each one of them is doing it differently from I, meaning
Yeah.
my technique, my process, my thought process. Almost everyone else is using drains. Almost everyone else is doing the lift. They're
Yeah.
done with fat grafting and all that in 2.5 hours. I will tell you, in
Mm.
my practice, I take 4 hours plus minus whatever length of time it takes in order to doing the surgery right. I will tell you, and this is now, if as a plastic surgeon, because I see a lot of patients who have had an explant done and it was not done correctly in a manner that
Yeah.
the entire capsule was not removed. Now, let me ask you this. How important is it to remove the capsule?
Very. It might, well, from everything I've read, it
Yeah, yeah.
needs to
That is,
all
if
go.
this is one thing that you take from this message, from this Facebook Live, this whole
Yeah.
surgery is about the capsule. Has
Yeah.
literally anyone can remove an implant. And I will tell you, the whole fixation is to assume both the implants are ruptured and to remove the capsular tissue completely, sincerely, wholeheartedly, definitively,
Yeah.
because that's where the surgery lies, and the surgeon has to. I myself, in my practice, I tell my patients, get your iPhone out and I'm going to airdrop the high definition pictures and videos to you. If you do not have an iPhone or Android, which is like 10% of the population, 20%, I say I'm going to WhatsApp those images and pictures because that is the ultimate proof. You will see visually from your own eyes, your own
Yeah.
chest, all the way from the medial side of the chest, all the way to the lateral, from superior to inferior, anterior, posterior, complete removal of the capsule, and from an incision that allows for good optimal visualization, safe surgery, blood
Yeah.
loss less than 5 cc's on each side. And part A is this, where you see the high definition pictures and videos of the chest wall showing complete removal of the capsule. And number two, the cutting open of the implant capsule and all of that inflamed tissue on the table. I want, as a physician, clinician, as a plastic surgeon, I see a lot of patients who have gone elsewhere. I talk to a lot of plastic surgeons. I have a lot of plastic surgery colleagues. Now I tell them, are you interested in breast implant illness? They say, hell no, quote
Yeah.
unquote. Absolutely not. I just want to enhance my practice so I can capitalize on additional patients in addition to the everything else. This is where in my practice, as you mentioned, I've only put in one implant. In the very beginning of my practice, I could have chose to put in implants and pay my debt off from student loans, med student loans. I
Yeah.
chose not to because I said I'm not going to do anything that is going to harm the patient because I saw clearly firsthand how the implants were ultimately only hurting the patient sooner or later. And I said, now you want to be very careful. If you see another, I saw and heard about another surgery colleague who basically said, I only explant. Well, I said, guess what? In your practice, under the same roof, you have another surgeon who's hired by you
So, yeah.
and he's dedicated to augmenting, and you're selling yourself better to the next patient because you're telling him or her that you're basically telling the significant other and telling the patient that you're only explanting because you're basically marketing yourself better. And this is, I say, what a shame, right? Because
Yeah.
people right now are doing whatever it can and everyone is capitalized. I say to the patients in my practice, I give the high definition pictures and videos of the chest wall showing because that's the ultimate of proofs.
Yeah.
And
It's
that
not for the
not only
light-hearted, those
that the
pictures.
yeah, and not only the capsule and implant is removed, it is the capsule is sent to pathology because that's the other ultimate proof. What are the dimensions of the capsule that was removed? And
Yeah.
then what was tested, because that tells us as well. And so the length of the surgery has to be 4 hours plus minus. This is minus fat grafting, minus the lift. This is just me, 4 hours plus minus, just to doing the
Yeah.
surgery right. Number two, the length of the incision is the diameter of the implant. Number three, you get the high definition pictures and videos of not only the chest wall, but also cutting open on the table. Number four, you get the implants back. And number five, you have the pathology. And then number six, you have the surgeon who's very assertively, very much outspoken and is telling you that, just like I am, that I'm a firm believer and I'm not augmenting. And this overall, the recipe over here gives you that authentication that it was done right. You want to do your homework, you want to do it right, you want to do it once, and you want to do it with the confidence. And again, I
Yeah.
cannot emphasize this enough. You must ask. And in my practice, I give my patients the high definition pictures and videos of the chest wall and cutting open of the capsule so that everyone knows what was done. Now, I have your pathology report and I'm going to
Yeah.
read this out. So, for
Okay.
the many plastic surgeons who say, leave the capsule behind, it's adding volume. It is too, the plastic surgeons are saying in Europe, in Canada, in the US, that this is too risky of a surgery. Do not do something that might potentially cause a pneumothorax. Do not do a surgery that it is too burdensome and uncalled for. Well, guess what? I will answer them by reading the pathology report. It says right breast implant capsule excision. So this is the capsule. the
Yeah.
pathologist read, Dr. Evans, who is the current chair of the Department of Pathology at now Henry Ford, benign soft tissue with changes compatible with implant capsule, foamy macrophage inflammatory response without refractile foreign material supportive of implant debris reaction. You don't want to leave the inflammation behind.
No.
And then on the left side, it says foamy macrophage inflammatory response without refractile foreign material supportive of implant debris reaction. And this is where you have the inflammation. You do not want to leave that behind, because then you might improve 30%, 50%, and you might think that might be the improvement. So it has
Yeah.
to be a pure, honest, sincere, religious, complete, wholehearted removal of the capsule off of the rib. And in my practice, I remove the capsular tissue along with the fascia of the intercostal muscle, fascia of the
Yeah.
serratus anterior, fascia of the pectoralis minor, the periosteum, perichondrium, such that you have absolute certainty of the capsule being removed.
Yeah.
Now, let me ask you this question. Um, how confident were you that this surgery was going to help you?
Very, without
You
sounding
know, because
cocky.
here you're gonna travel all the way to England from
Yeah, I wasn't going to
UK
come this
to the
far.
US. You're gonna spend all the money, the time and effort, go through the painful process, if you will, of the explant. How confident were you that this was going to be worth it?
100%. You have so many women that you've already done who share their journey that, I mean, I want to say I had nothing to lose, but I genuinely believed and knew it was going to be fine.
So I'm going to say to the FDA, if you're listening, don't listen to me, listen to a human being all the way from Europe, because they're as human as we are here in the US. Some
We
more,
are.
some less, right? I mean, and the bottom line here is we are physiologically the same. There
Yeah.
is ample evidence,
Yeah, there is.
ample. You're not looking for the reason why it's happening, because you just listen to the patients, right? In the FDA trial, when they're trying out new drugs like chemotherapy drugs, right? There are times where they stop the drug experimental, like arm A, arm B, what are the side effects? They stop the
Yeah.
drug right in the middle of testing, which can take 5, 7, 8 years. And they say, well, it's too harmful, too detrimental, we're going to stop. Well, guess what? We have this happening right now. Here you have patients who are hurting, who are basically getting palpitations, pain, their body is going haywire, and we
Yeah.
have clear evidence. It's not that, you need a anti-anxiety medication or a pain medication. How many patients have I taken care of that are on chronic Norcos or Percocets because their pain doctors have given them upper neck, back, shoulder
Yeah.
injections? So you were 100% confident. And I'll tell you, I've
Yeah.
heard this answer from many ladies, because many patients who have stated likewise that they were 100% sure. Some say 90%. It's very rare that I hear the patients say 50-50. So that was very, very strong.
Yeah.
Now, what do you want to say to someone who's kind of sitting on the fence and not sure, or they're
No.
like debating that it is their implants?
I'm biased because do it. You know your body. You know your body best. And I think deep down, it's a scary thing to do. And I think as a female, for most of us, we have implants done from an aesthetic point of view. So I think half the battle is you have to overcome that in your mind, but do it, because from the moment you wake up, it's the strangest. For me anyway, I woke up and knew immediately that it was the right thing. I could breathe. It was just all there.
So
And
how soon did you notice improvement?
straight away, I remember waking up and I had Kim, my nurse, at the other end of the room, and I could just take this big breath, and my chest was so light. Uh, I knew immediately just by the way I could breathe. And I will add, I was pain free. I woke up pain free, never took pain meds. So the fact
Now,
I'd been in
at
pain.
that time, I was not even giving the Exparel, right? So this
Okay.
was, you did not take, and I will tell you, 2/3 of my patients do not need much of pain med, if at all. And you were
No.
certainly indeed one of them, right? And
Yeah.
your pictures, if you look at them, are very graphic. So I had a
Yeah.
patient that I did operate on Thursday. I showed her pictures of her chest. You could literally take a small bowling ball and put it in her chest. And she
Yeah.
said, I'm in no pain. now she did get the Exparel, and she was asking me if I'm really the same patient. I was showing her the pictures. Then I said, go look at the high definition
Yeah.
fingerprint of the time and date and the location, and then the initials. So I see a lot of surgeons, and again, this is just more quality control. As a
Yeah.
surgeon, you have to write down the initials of the patient. This is no
Yeah.
HIPAA violation, the date of the surgery, and a card just to kind of show. And then a high definition picture and video. Video is very important because that tells you the cutting open of the capsule and also the chest wall, because that is the ultimate of proofs,
Yeah.
because nothing was photoshopped and it is as real as real. And so I see some surgeons are not even writing the initials or the date, and this the pictures are given. So you want to see the initials, and you want to use sterile gloves. That's very important because if there's a biofilm of bacteria, you want to get a good representative sample so you can treat the fungus, if that's what it is, correctly, so that there is no artifact from a non-sterile glove that's transferred into the microbiology specimen, because every patient that I operate on gets aerobic, anaerobic, and fungal. Now I just want to mention that I get this from a lot of my patients. Oh, I have to travel. Look, I have had this, in the last couple of years, patients from New Zealand that traveled to see me. I have patients from Bangkok, from the Europe, Switzerland, Germany, and we've done the Facebook Lives to Scotland. We have patients that came from Egypt. And
Okay.
Dominican, from and again other parts of the world. This is where you do your homework. Now,
Yeah.
how much research did you do on me?
Quite a bit. I Facebook stalked you, Instagram stalked you,
Yeah, no, very
Googled
important.
you.
Do your homework. See, initially, that I want to mention that you will be overwhelmed because there are so many questions to ask. If you go to my website, you will see top 20 questions to ask your explant surgeon. Are you board certified? Do you have hospital privileges? How many of these have you done? Are you going to give me pictures, videos? And the ultimate check and balance on me is my Facebook. So if you
Yeah.
ask me, every plastic surgeon who's explanting should have an open public Facebook account so that all the patients can keep talking and discussing. And I am being checked and balanced by every single patient every single
Yeah.
day, because all of the nice patients are talking to each other. They're verifying, and this is part of the informed consent. So that as you come to me, I can give you a board and a marker, and you can give me a lecture about how I do it. The other thing I want to mention, this is the second take home message. The first take home message is you have to see, no exceptions. In my practice, high definition pictures of the videos and the chest wall showing complete removal of the implant capsule and all inflamed tissue. And number two, high definition pictures and videos of the cutting open of the capsule. The second thing is you want to basically talk to the surgeon direct. I see another surgeon talking to the patient, and now all of a sudden the patient goes for surgery, another surgeon operated. You want to build a rapport with that surgeon. The surgeon's checked and balanced, and the surgeon is the one who's going to be answering the questions afterwards, not a PA or nurse practitioner or a medical assistant, because they do not know what happened in the operating room. Every
And
surgery is a challenge.
I will say that's true for the aftercare for anyone watching. I messaged you every point, every check-in. I messaged you, and you called me, and we had that sort of communication for quite some time. Whereas I know people that have done it in the UK, and their follow-up has been they've had their surgery and then not seen the surgeon or anyone for 2 weeks, and then they've only seen a nurse. It's that's sort of, certainly with yourself, the aftercare is phenomenal.
No, no, thank you. I will tell you, I only know what happened. My nurses have, I use the word very genuinely, no idea what happened in surgery because they're not surgeons.
Yeah.
No nurse practitioner, no PA. You're talking directly to me. And even before, when you
Yeah.
talk to us, you talk to me from start to
Yeah.
finish. Even the consultation is and it is important for the patients to talk directly. Now, I will tell you, in today's world and age, my time is money, right? This is what they say. And
Yeah.
I'll tell you, this is the investment you have in me, and I have the investment in you. So it's a direct one-on-one relationship with you,
Yeah.
so that you have that utmost confidence. So this is what you must ask So if you get dismissed or the nurse is answering the questions, I find that is wrong and incomplete, and this is not part of the informed consent. And unfortunately, if I talk to 10,000 patients who have implants and tell them, did you know that they're lifetime devices? They'll be like, no, my surgeon said they're going to be in me forever. Wrong information was given to them.
Yeah.
That there is an association between lymphoma and small, but again, underreported. And this is why
Yeah.
it's important to send the capsule off to pathology to do that complete analysis. So in my practice, just real quick, this is the Khan procedure. No need for a lift, no need for drains. Twilight deep sedation. The implants are
Yeah.
returned to the patient. Culture is done for aerobic, anaerobic, and fungal. High definition pictures and videos of the chest wall showing complete removal of the capsule. And every patient, regardless of age or size or cancer or non-cancer, they get the same surgery with the whole entire implant capsule and all of that inflamed tissue is removed sincerely. Now, the other thing I want to mention here is when your implants were returned, the right side was a 450
Yeah.
Euro silicone smooth. This was the first 2007. So the right one was the original where you had one surgery. The left
Yeah.
one was 375 textured silicone below. And we do
Yeah.
not know the make or the model. And this was suggestive of Mentor because it had the two arrows. And the point here
It
is
was.
your surgeon should have opted to put in the smooth as well, just to kind of make it symmetric because the textured
Yeah.
it has a different grip eventually, and the way it settles is different than compared to the smooth. And ideally, you should have had both of them replaced, if you ask me,
Yeah.
uh,
I
because
agree.
that way you would kind of start fresh, if you will. And that's
Yeah.
number one. Let me correct Matt. You should have had an explant done right and be done with it so that there would have been no second set. And that's what any good, reputable, board certified plastic surgeon would have done. Now, I just want to mention if you want to go to 100 different plastic surgeons who claim to be in the United States, and it's well over 350 plastic surgeons in the United States who are offering explants, by the way, maybe more, maybe 500. um, I think every surgeon is offering it, but they're not vocal about it. You
Mhm.
want to do your homework, do your research, and you want to basically invest such that you do it once, do it right. You want to get the high definition pictures and videos. You want to go to a surgeon who believes in breast implant illness. I have many patients who I've talked to. They said they went to their local surgeon, just like the four that you went to. They
Yeah.
don't want to even utter the word breast implant illness, and they're writing
Right.
down their like world explant specialists. So in my practice, I write down breast implant illness, desire for removal of bilateral breast implants,
Yeah.
explant surgery, medical necessity surgery, non-cosmetic surgery. Now, let me ask you this question. Did you need a lift?
Nope. Not at
How
all.
sure are you? Are you being nice?
No, I didn't think I was going to need one. I wasn't too sure what they'd be like afterwards, but I trusted you, and I really didn't need one.
Yeah, and I will tell
It's
you, I just saw my patient, 58-year-old. I saw the 89-year-old because she had an excellent surgeon, and the way I removed the excess skin, body contouring. And I'll tell you, I love to operate. I wish I was operating this weekend. I wish I was operating right now. I love to operate, and I'll tell you, no unnecessary surgeries. I'll say it
no.
again, no unnecessary surgeries, no unnecessary cutting around the nipple at the bottom. The patient, for example, I saw today, she was a caretaker and she got quote literally punched and kicked on the chest while at
Mhm.
work, workman's
Jeez.
comp injury, and she had implants from 2010. And she has an MRI that shows a rupture intracapsular on the right, and she has
Ah,
pain on the right side. Now, I said to her, just like you had a car accident, correct? I do not know what came first. Maybe they were ruptured to begin with. I do not know, but the bottom line is she's going to get the same surgery you are, where the entire implant capsule is going to be removed. This is not the time to be doing a lift. There is complete, sincere dedication into doing the surgery, and what is minimal surgery, but effective surgery. And look, you can get by 80% of the time in my practice, having done thousands of these surgeries, without doing a
yeah.
formal lift. Because once you do that lift, you're going to cause a lot of scarring in around the nipple areola and
Yeah.
cause more harm than good, and ultimately not worth it, especially with fat grafting. I wanted to see the video that I did on Friday 3 days ago Fat grafting leads to cysts, uh, painful, sometimes scarring as a result of the fat that takes, nodules, irregularities, some sensation at the donor site. You have patients where their self-monthly breast exam is altered or their mammogram is altered because it might pick up on nodular fat, dead tissue that might get picked up and now might obscure a good monthly exam or a good mammogram.
Okay.
Now, I will go ahead and let you, what message do you have to the many patients who are listening, to the FDA, to the many plastic surgeons about your journey?
As in it doesn't exist, or like as in they should.
So anything, because right now, let's say, had you come to the US and
Hmm.
gone to the top 20 hospitals in the country,
Yep.
right? And your implants were old enough, right? They
Yep.
would have all offered you, guess what? A replacement.
Replacement. Yep. I
What
have
would be
that here.
choice B? A replacement. What
Yeah.
would be choice C? A replacement. Choice D, replacement. And I will tell you, there are many patients who have taken that bold step and say, you know what, I don't want to deal with this 10 years, 15 years, maybe 7 years later, because remember, they're not lifetime devices, correct?
No, they're
What
not.
message do you have to anyone who's listening about your journey, about the young 22-year-old college student or the 18-year-old or the 16-year-old that I talked to not too long ago from Mexico who got her implants as a
Oh wow.
16th birthday gift? Because
Wow.
in Mexico you can get those implants. In the US, if you're 18 or less,
That's
for
amazing.
cosmetic reasons, you cannot get sealant implants. In the US, silicone, the cutoff is an older age, 21, or I believe 22.
Right.
22 is the age cutoff. You cannot get it for that. So if that 22-year-old college student who's graduating is getting her first job, who's thinking about augmentation, what message do you have for her?
Think about it wisely. Read your group, read many women's stories. Um, yeah, I don't want to tell someone no, don't do it. I feel that's wrong because I did it. But you have to be willing to replace them every 5, 6 years if you're going to do it. But given my time again, I'd say don't do it because you it's hard to know if the symptoms you're presenting with are truly premenopausal, perimenopausal symptoms, or are they because of these foreign objects that are gel bleeding into your system? And yeah, just long term, it's just not worth it.
Sure. No, no, it's not worth it. Now, as a board certified plastic surgeon, this is the Facebook Live I did 3 days ago. Informed consent. Know what you're signing
Yeah,
up for. Know
yeah,
that they're not lifetime devices, as you very well said. You said
yeah,
5, 6 years. That in my anecdotal here is 7 to 10 years. The textbooks, the manufacturers will say 10 to 15. Remember, the longer you have them, the higher the chances are rupture.
yeah.
Remember, if you look at the mentor advertisement, they tell you get an MRI at year 3 and then every 2 years
No,
thereafter to look for a silent rupture. Were you aware of that?
no, and I think my biggest bugbear was I was told they were safe as houses. I don't know if when I had mine put in, I don't know whether they had a black box warning on, but I was told that nowadays they're so safe. It's like a jelly baby. Like I can cut this in half and it's just like a jelly baby. So it's fine. It can't leak. Like I had a very big upsell on how safe they were. And I was definitely never made aware that should have scans regularly.
Sure, if
So
I
when
may.
I saw your video where it actually says on the like you should have the scans every few years. I was
Right, right. So
absolutely not
this is
aware.
the mentor advertisement. This is the back of the journal that we read. This is the mentor advertisement. It says breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications and which
Yeah.
will require more surgery. I'm going to read two more items, then I will finish, and then I'll have you say the final word. Again, not my words. This is the black box warning. Breast implants have been associated with the development of cancer of the immune system called breast implant associated anaplastic large cell lymphoma, BIALCL. The cancer occurs more commonly in patients with textured breast implants than smooth. So that means it does occur with smooth, but to a lesser extent, but textured are notorious, which is what you had on the left side. The
Yeah.
right side was not completely innocent either, is what I'm trying to say. Some patients, although rates, so it says over here, This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BILCL. And then patients receiving breast implants have reported a variety of systemic symptoms such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Guess what? Tell this to the plastic surgeon that it does exist and it's right here.
Yeah.
With all due respect to him, um, uh, the individual patient risk for developing these symptoms has not been well established. Period. Some patients report complete resolution of symptoms when the implants are removed without replacement. If you read the fine print, it says MRI screenings are recommended 3 years after initial implant surgery and then every 2 years after to detect silent rupture. Silent rupture means the exam's excellent, no pain, and now you go in getting an MRI, or you go in surgery and lo and behold, to your surprise, you see a ruptured implant. So it could happen as early as three
Yeah.
years. Now, let me ask you one final question.
Sure.
The How much better are you now compared to before 2023?
Night and day.
So basically, you had your surgery done 9/6/2023. On 9/5, you were, let's say, hurting. How much better are you now, in 2025, July 2025?
It's
50%, 70%, 90%, how much?
I want to go over 100. It's night and day. It's two totally different people. The energy, the lightness. It's when I think this time last year, I didn't think I could have any more energy. I thought you'd done a wonderful job. I was so happy they were out, and then now I'm another year on, and I've got even more energy. It's kind of like the healing journey just keeps getting better and better. It's 100% isn't enough. It's
Mhm.
totally changed everything.
Right. No, and I will tell you, I tell everyone, listen to what you have to say.
Yeah,
And I want to mention, last time I did the Facebook Live was a nice patient from Scotland. I
that's just
really
lovely.
enjoyed her accent. My chemistry teacher was from Mr. Clark was from Scotland, and a good half, if not more, of my teachers were from England. And so I did the University of London O-level exams. This is back in high school, a long
Oh,
time
God.
ago. So whenever I hear the British accent, I get reminded of my high school time.
Ah,
Now it was an absolute pleasure listening to what you have to say.
oh, thanks for
This is
having
a
me.
surgery. Again, you only improve 90% of my patients, if not more, have improved. This is a surgery where, do your research, do your homework, and feel comfortable. And
100%.
please, I will let you finish.
I would just say exactly what you did. It's please do your homework, investigate your surgeon, make sure they're going to give you everything. When they say, if you're going to go to a surgeon that says they can't do it or it's not possible, they're not the surgeon. It is possible. Dr. Khan is fantastic, but there are other surgeons out there if you can't get to Michigan. But do your homework on your surgeon because you do not want to do the operation again. Do it once, do it right.
Mm, Great. No, thank you. Thank you very much. A pleasure. Take
Oh,
care. All
thanks
the
for
very
having me.
best. Yeah. Convey my
Thank
regards to your
you.
family. All right. Bye bye.
See you soon. Bye.
Bye bye.